Hello, and welcome to Health Matters with Marcy. Today, we are going to talk about the silent killer. Shh. The silent killer is hypertension, better known as high blood pressure. Why is it called the silent killer? Because most of us go around and don't even notice that we have it until it is too late. Signs and symptoms of high blood pressure could be dizziness when you go from a sitting to standing position. Most of us just say, "Oh, I got up too fast, no big deal." Headaches. A lot of us have headaches and we just dismiss them as, "Oh, it's just a normal headache." Ringing in your ears. A lot of people think, "Oh, I don't have any problem, it'll just go away," and generally it will go away eventually. Or swelling of your feet and legs is often dismissed as, "I worked too hard today," or "I was on my feet too much." People dismiss these signs and symptoms that can be an early detector for high blood pressure. So what is normal blood pressure? 120/80 is normal blood pressure. If your blood pressure gets higher than 140/90, you have hypertension or high blood pressure and may need to be treated. High blood pressure is especially important because it is a precursor to heart disease and stroke risk. What are ways to reduce your risks of hypertension? Lose weight. Avoid smoking. Increase your exercise to 30 minutes a day, 3 to 4 times a week, and lower your salt intake in your diet. If you are having any symptoms of dizziness, headaches, ringing in your ears, swelling of your feet and legs, or if you have a family history of hypertension, be sure to get yourself screened on a regular basis. You can be screened at a normal doctor visit, or you can go to a local pharmacy. Walgreens, CVS, Rite Aid, Walmart. Many of the pharmacies have blood pressure machines, or you could simply ask the pharmacist to check your blood pressure. If you are concerned that you may have hypertension, it is important to keep a record of your blood pressure readings for about 2 weeks to see if it could be just a transient high reading. Were you stressed? Were you running around? Sometimes you may go to the doctor and get white coat syndrome. That means that you just get nervous when you go to the doctor and your blood pressure goes up a little bit, but once you're home, you have no problem. Therefore, a blood pressure log would be very informative for you and your medical provider in treating your hypertension. It is important to take your blood pressure about the same time every day. It doesn't matter what time, morning, noon, night, whatever works for your schedule. But it is important to take it at the same time every day and keep a log for about 2 weeks. Your medical professional can do an average of your blood pressure readings and determine whether or not you have hypertension or are at risk for hypertension. So remember, 120/80 is normal. Anything over 140/90 is hypertension, unless, of course, you are an older adult. The new guidelines for hypertension are anyone age 18 to 59 who do not have diabetes or chronic kidney disease. Your level is 140/90. That is your target. Anything over that, you have hypertension. If you are 60 years old or older and you have diabetes or kidney disease, 140/90 again. If you are 60 years or older without diabetes or kidney disease, you get a little leeway. The level went up to 150/90. It is important to be aware of what your blood pressures read because, like I said before, high blood pressure is the silent killer. And without monitoring, sometimes you never know until it is too late. Until next time, stay healthy.